Hello, we are the Doctors Bjorkman, and this is our sit-down Sunday Q&A where we take the time every week to answer some of your questions. This week we're going to answer 3 questions.
Yes, one about breastfeeding and kind of the return of fertility or getting pregnant again.
Yep. The next is going to be about eczema and skincare in infants.
And last but not least, talking about what to expect if you are going to have an HSG or a Hysterosalpingogram.
Yeah, and just in case this is your first time meeting us, I'm Kurt, I'm a board-certified pediatrician.
I'm Sarah, I'm a board-certified OBGYN.
And we are the Doctors Bjorkman.
All right, let's get right into it. This week we actually had a bunch of questions about breastfeeding and kind of trying to conceive again and the return of your fertility. And so, Abby P said, does breastfeeding affect your next pregnancy? ASMRK said, do you think breastfeeding impacts natural family planning? Can you talk about trying to conceive while breastfeeding? Sandy Mejia said, I'm 6 months postpartum and breastfeeding full time. My cycle has not come in yet, but we want to get pregnant. Is it possible? So maybe is the answer. The thing that triggers a period is ovulation. And so when you're breastfeeding and you haven't been having cycles regularly, eventually at some point your body ovulates and then after that you get a period. So if you ovulate, you may get pregnant before you get that first period. And so possible. Hard to tell if you're not regularly tracking your hormones a little bit. And so it's really tricky when you're breastfeeding. So we'll come back to that a little more in a minute. Sarah Martin also said, how long does it typically take for your cycle to go back to normal post-pregnancy? For reference, I have an 11-month-old, got my cycle back when she was 6 months. Always had a short cycle, 24 to 25 days, and pre-pregnancy ovulated around day 12. Post-pregnancy ovulation is not happening until around day 16 to 18, still with a cycle around 24 days. We want to try for another baby soon and know that a cycle like that makes that tough and impossible. So many things to unpack there. So how long does it take for your cycle to go back to normal post-pregnancy is so highly variable for every single person. Often it is somewhere between kind of 6 and 18 months if you are breastfeeding. Some women who are breastfeeding get their cycles back at 6 weeks. Some do not get their cycles back until they completely stop breastfeeding, whether that's 18 months or 2 years or however long they're breastfeeding a lot. So highly, highly variable. There is something called the lactational amenorrhea method that says that if you are exclusively breastfeeding, meaning going no more than about 4 hours, that is the only nutrition baby is getting, and you are less than 6 months postpartum, it's 99% effective in saying you are probably not ovulating yet. So full-time breastfeeding moms, most of the time, don't get their periods back before 6 months. Again, of course, there are people that do. So,
lots of surprise babies out there for some,
indeed.
I'm sure.
Yes. So the thing that you mentioned and kind of the why to all of this is when you are breastfeeding, the hormone prolactin is elevated. That helps develop breast tissue as well as milk production. And so that elevated prolactin is really, really important for milk production and feeding your baby, but it also inhibits the reproductive hormones that tell your body, hey, we want you to ovulate and things like that. So a high prolactin is good for milk production, but it inhibits the directions from your brain that we should ovulate. So that prolactin being elevated, as you said, sometimes your cycles do come back as babies start to sleep longer, you don't breastfeed quite as much, and so your cycles return, but since you are still breastfeeding, that prolactin is still a little elevated, and often women have a short luteal phase, which is what you described. So the luteal phase is the part of the menstrual cycle after ovulation. So the first part is the follicular phase when that follicle is growing, then you ovulate, and then there is the luteal phase. And so when prolactin is high, a normal luteal phase is really between 12 and 14 days. When it's less than that, it's often called a short luteal phase, and we know that we need a good strong luteal phase to support a embryo in implantation and starting a pregnancy. So as you described, if you are ovulating on day 18 and your period's showing up around day 25 or 6, that's really only a 6 to 7 day luteal phase, which is short and very commonly seen with breastfeeding moms with prolactin elevation. So even though your cycles are back, it's, as you said, tough to start a family. So the moral of that story is it's different for every woman. Some people's fertility does not truly return until they've completely weaned from breastfeeding. Some people get pregnant at 4 months while they're breastfeeding. It's different for everyone, which is why we always talk about postpartum contraception at that 6-week visit, because we don't know where you're gonna fall.
Yep, I think it's also important to think about even like the timing of that second baby. We did a video all about like when should you have the next baby, what is the evidence, are there any benefits or risks of like having babies early or waiting longer, when is the best time for mom in terms of letting her body recover.
Recovery, breastfeeding, there's so much to weigh. Like, do I want to breastfeed my baby till 2? Maybe, and maybe that's a wonderful relationship that you have, but maybe it's slightly impacting your fertility and you can't get pregnant again. And so that was something I think we also ran into, you know, when we started trying around the 6-month mark. I had short cycles. I was like, my prolactin's elevated. This is probably part of it. So we quit breastfeeding because I thought maybe that was also affecting some of our fertility. So I've been there. I know it's so frustrating to love breastfeeding and also want to have another baby. So check out our videos and we wish you the best.
Yeah, but you continue to breastfeed until a year of age and...
Sort of. I like direct breastfed until she was about 9 or 10 months old, and then had milk in the freezer that I had stored. I continued getting up in the night to pump even after she had started sleeping through the night. And so we had a bunch of milk in the freezer so she got breast milk until she was 1. But I had kind of quit pumping. I gave up. Pumping is not always fun. And I think it was like she was 9 or 10 months old when I quit pumping. So
great.
Yeah.
So the next question. This comes from Katie H. And she says, not sure if you already covered this, but how to care for baby skin. I've got a 3-month-old and a 2-year-old. Is bathing every night necessary? Also, when should I call the doctor about a rash? What types of products should I use and what to avoid?
Yes, and I saw a couple of questions as well about eczema and babies being uncomfortable, so this is a great one.
Yep, absolutely. And so this is something that I think every parent's going to run into with their little one, is you're going to see rashes at some point in time. We've done a video about diaper rash and things like that before. Check that out. But in terms of like kind of rashes elsewhere in the body outside of the diaper area, especially as we're going into fall and the winter months when the dry skin is going to pop up. The question is, what can you do for your child? How do you help keep their skin healthy, and when do you need to act on it?
Right.
So the first thing is moisture is critical, like keeping the skin like appropriately hydrated. And so the first part of that is to not dry it out. And so thinking about things that are really harsh on baby skin can be things that have scents or fragrances in them, and dyes or other chemicals like that. So try to use scent-free, dye-free things. And so this is everything from your laundry detergent that you're washing the baby's clothes in, to the soap you're using in the bathtub, to the moisturizer you put on their skin at night or in the morning whenever you're doing that routine. I know it's really interesting, there's like baby marketed brands of laundry detergent that have tons of fragrance in them that smell wonderful and make your baby smell so fragrant and beautiful, but that fragrance itself can actually be really irritating to the skin. And so we used a Free and Clear brand of laundry detergent that we've just always used for ourselves, but that just was, rather than buying the baby laundry detergent, just Free and Clear is the best way to go from that standpoint. Also, the same thing for soaps and her shampoo that we use in the bathtub. Again, Free and Clear, no scents, no fragrances. Then
other things are, do you bathe them every night?
Okay. And then like this leads us to the question of, what about baths? How often do you need to bathe them? So definitely early in infancy, you do not need to bathe your baby every night. Like the only part of them that really gets dirty is the diaper area, and so keep it clean, etc. Different people's skin types like can tolerate more bathing versus less, but as long as your baby is clean, the skin doesn't need to be washed every night. And actually there's some benefit of the healthy skin oils that help keep the skin healthy.
Right.
Having said that, when our little one was, I don't know, by the time 2 months of age, we had like a nighttime bath as just part of our bedtime routine.
Yes.
And she's been able to tolerate that. One thing that we've worked with though is like a really good moisturizing routine for her, especially in those winter months. Right. And for us, that was, we got a scent-free, dye-free ointment. Okay, again, this is an ointment, not a lotion. It just means it's thicker and it does a lot better job of like coating the skin and staying on the skin. We like Aquaphor a lot. We're not sponsored by them, obviously, but Eucerin is a good brand. Anything that is, again, scent-free, dye-free, you can use Vaseline even, is the same concept. It's got no scents, no dyes, no fragrances, and just like helps keep the skin's natural moisture inside, creating this protective barrier over it. If you've got a kiddo that's got eczema and you're really struggling with that, I would say get a big tub, use it at least twice a day, if not 3 times a day. Keep things moisturized from that standpoint. If you're really struggling, you say, gosh, despite doing this, we're still having lots of dry skin, lots of eczema everywhere, be sure to see your pediatrician. There are times where you might need to use something more like a steroid cream or even special washes to help prevent infection in really severe cases of eczema. But at the end of the day, just to say it one last time for the 10th time, the best thing you can do is scent-free, dye-free, and then lots of moisturizing. We loved Aquaphor twice a day, especially during the dry fall and winter months.
Yes. So, to circle back, when do you call your pediatrician about a rash?
Yeah, so most dry skin, obviously, you're going to be able to handle at home. Most diaper rashes we've talked about. If you feel like that rash is persisting, it's been a week, it's not getting better, is a great time to just call, even check in with the nurse line, and they may say they can help you triage, is this something that needs to be seen in clinic or not. There are times where even eczema can be really itchy, and antihistamines may be helpful to just help your toddler sleep or your young child sleep, and can help calm some of that response down.
And I think generally as physicians, we don't want you to worry alone at home. And so if you have a question, that is why you have a pediatrician. They have a nurse triage line. We want to answer your questions and help you figure this out. That's our job. We love doing it. So don't hesitate to call your pediatrician with a question.
Absolutely.
Anytime. Goes for the OBs too. Yeah. So last question here, we'll do real quick. Sarah Ridge says, what to expect from an HSG? Mine is Monday. All right.
Good luck.
Sarah, yes. I'm sure you've read or heard some horror stories. My hope is it's not going to be as bad as you expect. So an HSG, and for those of you who don't know, is a hysterosalpingogram, which is a fancy word for it's kind of a tubal dye test. What we're doing is injecting contrast into the uterus, so it fills up the uterus and hopefully goes out the tubes to look and see, are the tubes open, is kind of the big thing, and it kind of can show the inside uterine architecture to make sure it's normal. So to do an HSG, usually you have to go to the hospital or somewhere where they have kind of what we call a C-arm or a radiologist, because they are taking x-ray pictures as they're injecting this dye.
This could be in some offices though too, right?
Some clinics have a small C-arm in their office, so it may be at an office. Sometimes it's at a hospital, it just depends. So definitely if you don't have a contraindication, to recommend taking 600 milligrams of Motrin or ibuprofen before going for your HSG, because it can be kind of crampy. Anytime you put something in the uterus that isn't supposed to be there, the uterus gets mad about it and tends to cramp. So you get there for your HSG, you'll take a pregnancy test because they want to make sure you're not pregnant. The best time to do an HSG is really between kind of day 6 and 12 of your cycle. We don't like to go much farther than that because we don't want you to ovulate or disrupt a pregnancy. So you show up to the hospital, you take your pregnancy test. They will have you get undressed, usually in a hospital gown, and then get up on a table in stirrups. Such a fun time. You'll sign a consent form. The provider will place a speculum so that they can see your cervix, just like how you start out when you get a pap smear. They place a speculum so they can see your cervix, and then pass a very small catheter. It's kind of like
a long straw.
A long straw, but it's like cooked spaghetti, so it's very flexible, and they pass that through your cervix. Often they'll inflate a little balloon so that that catheter doesn't fall out. That part can be crampy because, again, uterus gets a little mad that there's a balloon blowing up. And then radiologist comes in and they start to inject some contrast through that catheter. And while that's happening, the radiologist is taking x-ray pictures.
And the contrast is just radio opaque dye that
Correct.
fills the space, and then x-rays shows us exactly where the spaces are.
So we can see what the inside of your uterus looks like, and then we watch that dye as it moves out through the tubes. And if your tubes are dilated or if they're blocked, then we see them. They kind of fill up, they get dilated, and that contrast doesn't flow out into your pelvis. And I know you're like, oh, I'm getting contrast into my pelvis. The amount of contrast required is like the amount, a teaspoon. It's a tiny, tiny amount, so it's safe. And they take pictures to find out if those tubes are open, are they dilated, are they blocked, and it gives us a lot of information about, are those tubes open? Can, you know, when you're ovulating, can that sperm get to the egg? So, can be crampy, especially if your tubes are blocked because that dye doesn't get out and it gets stuck there. And so that can be a little crampy. The good thing about all of this is usually it takes 5 minutes or less to do the whole thing. And then I always tell patients, keep taking your Motrin and tell your partner that they owe you a back rub or something when you get home, because it's not always a fun time.
Or jewelry or
yeah, at least a good back rub.
Yeah.
So good luck. We'll hope for sparkly tubes. The dye goes right through. And if not, go talk with your REI about next steps. So we'll be thinking of you.
That's going to be it for us this week. Make sure you're subscribed so you catch our regular Wednesday content.
Yeah.
Please feel free to leave us questions. We try to get to a few of those every week, and hopefully we're answering yours too. Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.